NICD has warned that an increase in COVID-19 fragments in wastewater samples may indicate an impending wave of infections. These were found in samples at the water treatment plants near Pretoria and as well as in Johannesburg and Ekurhuleni. Other worrisome samples were found in Durban and in Bloemfontein. Senior medical scientist at the NICD, Dr. Said Rachida, joins us now to explain whether we should be indeed concerned. Dr. Rachida, good afternoon, and thank you so much for joining us.
Thank you for having me.
Firstly, when we talk about wastewater testing of COVID-19, I mean, why does this happen? Why specifically wastewater testing for the virus?
Okay, to begin with, so the COVID-19, people who are infected with COVID-19, whether they present symptoms or not, share the virus in their feces. And so that feces makes its way into the sewage network. And that's why we are able to test the sewage network and detect the genetic materials of the virus. And that is going to give us an indication of the prevalence of the virus in the community that is served by the treatment plant. So that's why, and then by monitoring those levels, it actually gives an indication, sometimes even before clinical cases start to spike, that there may be an increase in the number of cases.
The perception or belief, Dr. Rachida, is that COVID-19 is an airborne disease. So how is it able to survive and be detected in wastewater, and how accurate are the results that you get when you make those tests?
Okay, first of all, I need to emphasize that SARS-CoV-2 that we found in the wastewater is not infectious. So if anyone was to drink wastewater, raw sewage, they wouldn't become sick with SARS-CoV-2, but they can't get any other infectious disease. But the problem is what we do is we detect the genetic material, the RNA fragments of the virus into the sewage. That is what gives us an indication that there has been an infected person or infected individuals within the community that have shared the virus. That is what we detect. So what we detect cannot make someone sick, but it gives an indication that there has been infected people within the community that have shared the virus.
And from the current readings, how different are they from what we've seen, say, in the past 2 years, where we were at the peak, if one can use that word, of COVID-19?
Okay, so the sustained increase in the levels of SARS-CoV-2 that we are currently been recording actually takes us back to what we've observed at the right weeks, about 2 to 3 weeks before the beginning of the fourth wave. So yes, it could give an indication that there may be a potential wave of infections, but there is no guarantee that this is going to be the case. And I mean, and if you consider the level of immunity within our population, with the number of vaccination of people that have already been vaccinated or that have already gained immunity through natural infections, whether there's going to be another wave of infection at this moment right now, we can't tell you. Yes, we can't tell you.
But what do the readings say at this point? From what you have seen, is there cause for concern? Is it showing any signs of a possible wave that is coming?
The readings that we are showing is just showing that there are people that are still being infected with the virus within our communities. They may not be presenting symptoms, but they may just be presenting very mild symptoms that do not necessitate them to visit any hospital, any health facility to get tested or to receive treatment. So that is what the levels is telling us. But whether there is going to be a wave of infection in the coming few weeks, that we cannot say.
All right, Dr. Rachida, we're going to have to leave it there, but thank you so much for coming through to talk to us there.